Hi, everyone. Thanks for joining us. We're going to give everyone about 20 more seconds to join before we get started. So thanks so much. So welcome, everyone. I'm so pleased to have everyone joining us tonight. I know it can be a challenge to do these evening events, and I really appreciate your engagement. So I'm Becca Bell. I'm a pediatric intensivist at the University of Vermont Children's Hospital, and I'm currently the president of the Vermont chapter of the American Academy of Pediatrics. And we are here tonight to talk about the COVID-19 vaccine for children under the age of 5. We know that parents have questions, and we know that you all have your own, your child's medical provider to talk to, but we also wanted to offer up our insight and expertise so you could get your questions answered tonight. So in a moment, I'm going to turn this over to Dr. Leah Costello, who is a pediatrician at Timberlane Pediatrics in South Burlington, Vermont. And she's going to go through some basic information about the COVID-19 vaccine in children under the age of 5. It'll probably be about 20 minutes of information that she'll give, and then we'll open it up to questions. So if you have questions, please put it in the Q&A, and we are going to do our best to answer everyone's questions. You may notice that if there are a lot of very similar questions, I may paraphrase and sort of lump the general idea together. But hopefully everyone will get their question answered tonight. And again, we're so pleased to have you all here tonight, and thank you so much. So with that, I'm going to turn things over to Dr. Leah Costello.
Thank you, Becca. I appreciate it. My name is Leah Costello. I'm a pediatrician at Timberlane Pediatrics in South Burlington. And as you can imagine, getting a lot of questions about COVID vaccines for kids of all ages, but certainly right now for the youngest of our kids. I am also a mom of 3 and recently got our youngest, our 3-year-old, vaccinated as well, which was very exciting. So we've heard a lot of questions from families. Some are specific to the younger kids, some are really just generalized questions that we continue to hear throughout the entire time that we've been able to offer vaccines to kids since about May of 2021, when we started vaccinating 12 and up. But the most common questions, and we'll hope to address a lot of these tonight, are, does my child need to get vaccinated against COVID? What are the differences between the 2 vaccines, the Moderna and Pfizer vaccines? What are the risks of vaccination? What are we protecting kids from? I think that kind of really ties into the first question of why does my child need this? And then a really important question of what if my child already had COVID? A lot of families are asking that because many of us and our children have already had COVID, even recently. Next slide, please. So as of right now, the approval in June, the EUA approval for these vaccines, and the statement from the CDC following that approval of the vaccine, the CDC and pediatric medical professionals, including myself, including the American Academy of Pediatrics, recommend that all children ages 6 months and up get vaccinated. There is a vaccine available that is safe and effective, and we feel like regardless of prior history of COVID infection and regardless of underlying health conditions, there's no health conditions that preclude a kid to get the vaccine. So we now recommend all children 6 months and up get vaccinated against COVID. Next slide, please. And we also forgot to realize that I mentioned that Sarah Ferguson is providing our ASL interpretation. If she's not spotlighted in your view, you can pin her and you'll be able to see her. So how does the COVID vaccine work? This is the same, the Moderna and Pfizer vaccine have the same technologies. This vaccine works really similar to other vaccines that your child has received. The pathogens like SARS-CoV-2 or other viruses that cause COVID, the SARS-CoV-2, the virus that causes COVID-19, invades and multiplies inside the body. The vaccine helps by priming the immune system to make special proteins called antibodies to fight the virus, so that when that SARS-CoV-2 enters your body, the immune system is prepped and ready to go. After vaccination, your child will have a lower chance of getting COVID, although of course they may still get infected. And I know many of you have been in that scenario yourselves. The most importantly though, and this is why we are recommending vaccines, is that if a vaccinated child does get infected, that vaccine is very effective at preventing severe disease, such as disease that would cause hospitalization and preventing death as well. Next slide, please. So why are we vaccinating? We're vaccinating to prevent serious illness, hospitalization, and death in those infected with COVID-19. It is rare in kids for those things to happen, but it does happen. And it that shouldn't happen to kids. And we now thankfully have a vaccine where we can say that we can prevent serious illness, hospitalization, and death. We know that vaccine immunity lasts longer than immunity related to infection and is more effective than immunity related to a COVID infection. So those are the reasons why we vaccinate, and what we've been recommending for the last more than 12 months now to children 12 and up, and since the winter for kids 5 and up. Next slide, please. So how do we know that COVID-19 vaccines are safe for youth? We know that the CDC and FDA require randomized placebo-controlled trials. That is the, spacing on the word, but that's like the gold standard of trials, that we can see that the vaccines are both safe and effective with that type of trial. These have been the same type of trial that was performed in adults 12 and up, 5 and up, and now 6 months and up. This vaccine is going to continue to be monitored really closely. The CDC has told us that the COVID vaccines will have, quote, the most intensive safety monitoring in US history. Next slide, please. So here we are getting into what the vaccines are. So the 2 vaccines that are available for children ages 6 months and up are the Moderna and Pfizer vaccines. These are both mRNA vaccines. mRNA vaccines, the M stands for messenger. These vaccines give instructions to the body to make a harmless piece of spike protein. So spike protein is a type of protein that's on the surface of the SARS-CoV-2 virus. So it gives your body instructions to make a protein that looks like that spike protein. Then your body says, wait a minute, this protein you just made looks foreign. I don't recognize this. And it starts to make antibodies. Those antibodies can help prime our immune system with our B and our T cells, which are part of our immune system. And those cells have memory. They can remember when they've seen this again. Within days, within about 3 days, the mRNA from the vaccine disintegrates and is not present in your body anymore. The mRNA does not interact at all with your body's genetic material. It cannot get inside the nucleus of our cells. The second dose of the vaccine is the same vaccine again, and at that point, it tells your body to make more spike proteins, and now your body's ready. It's seen those proteins before, and it provides even a more robust immune response and continues to kind of re-up the immune system, remind those B and T cells, hey, this is going to be something you may see again, and to have that long-term memory to be able to make antibodies to fight off COVID-19. When a child then is exposed to the virus itself, your body is ready. It can make antibodies right away. The immune system can be ready right away, and you can have either no infection or a very mild infection because your immune system is primed, prepped, and ready. Next slide, please. These are vaccines that have been around now since very late 2020. Over 570 million doses of mRNA vaccine have been given in the United States. I myself got my first one right around Christmas time of 2020. I'm sure Dr. Bell the same. Over 10 million doses have been given in children ages 5 to 11. So over 10 million children ages 5 to 11 have received at least one dose, excuse me. My two older children received theirs actually the night it came out in Vermont. And then over 17 million adolescents ages 12 to 17 have received at least one dose in the United States. This is a lot of mRNA vaccine that has been distributed and administered in the United States in the last year and a half. And we have seen very little side effects. And we'll talk about that a little bit later. And especially in the 5 to 11-year-olds, we've seen very minimal side effects, and in the older kids as well. So, next slide. So what do we know about these trials? So the Pfizer trial included children 6 months through age 4, so right to the day before age 5. And the Moderna trial included kids 6 months through 5 years of age, so up to 6. It included children of a broad range, so kids who have underlying health conditions, kids of different ethnicities, kids of who've had prior COVID infections, kids who have not had prior COVID infections. So they and children who are healthy with who do not have any underlying health conditions. So they really did include a broad range of children in these trials. Next slide. And then, so what about the side effects of these vaccines? A lot of kids actually don't have any side effects at all. The most common ones are ones that we think of for any vaccine, honestly, any of our routine childhood vaccine. Maybe some local reaction right at the site, a little redness or swelling right where the injection was. And then the systemic symptoms, so that's like fever, fussiness, fatigue, actually occur at a lower rate in this age group than in adults. The most common that were seen in the studies were fatigue and irritability, and all of them were mild. These are temporary side effects, and they go away within a few days, even less than a few days most of the time. So these are the side effects have been no different than any of the other routine immunizations that we recommend and encourage for your children. Next slide, please. So the Pfizer vaccine is 1/10 of the dose of the adult vaccine. So children will get 3 micrograms. Children 6 months to 4 years. 5 to 11-year-olds will get 10 micrograms, and 12 and above, so 12 years old and adults will receive 30 micrograms, which now has full FDA approval. And actually, I think that I just heard that the 12 and up, yes, has now full FDA approval, not just adults. It's fully FDA approved for kids 12 and up. They are looking for a similar immune response to a control group of 16 to 25-year-olds. So the goal of the study is to see, did this dose, this 3 microgram dose, induce the same immune response that the adult dose did in the 16 to 25-year-olds. They saw a similar immune response after 3 doses of the Pfizer vaccine at 3 micrograms per dose. There were no adverse events related to this vaccine reported during the trial. Next slide, please. This is the type of trial that they do. They do a phase 1 where they find the dose, and then a phase 2-3 where they have randomized people in a 2-to-1 randomization. So more people got the vaccine than got the placebo. So in total, just over 3,000 kids got the vaccine, and just over 1,500 got a placebo of the saline. And the initial trial, the phase 1 part, was about 60 kids who they were trying to see how many side effects did they have with the 10 microgram versus 3 microgram dose. So next slide, please. This is a chart looking at systemic events, so side effects that not just right at the site of the vaccine, but something that would affect the whole body within the 7 days after each dose. So the top line is dose 1, middle line is dose 2, and the bottom line is dose 3. In each column, the placebos from the vaccine are on the left, and then the side effects from the vaccine are on the left, and the side effects from the placebo are on the right. I think these charts are great when we see that actually people in the placebo group also reported fatigue in their children. Maybe our kids are just tired like us. So this is actually in kids 2 to 5. But so you see that actually fatigue was the most commonly reported, although not statistically different than fatigue reported in the placebo group. A small amount of diarrhea and a very small amount of fever noted in all 3 doses. So really quite a low reports of side effects. Next slide, please. This is a similar chart, but this is for the kids 6 months to 2 years. They looked at fever, decreased appetite, drowsiness, and irritability. It starts from dose 1 on the left and goes towards dose 3 on the right for each of these. And you can see again that there were side effects. People did report stuff when their child received just the placebo vaccine, but there was a little bit more decreased appetite and irritability and drowsiness after the 3rd dose in the children who received the vaccine. But again, pretty small portion of kids who are compared to the placebo who are getting minor side effects that you probably see after your kids get their routine immunizations too, that they're just a little more sleepy or a little more irritable that evening or the next day. And again, this is Pfizer that we're looking at here. Next slide. The Moderna vaccine was looking at a dose for kids 6 months through 5 years of age. They selected a quarter of a dose of the adult dose, so children would get 25 micrograms in this age group. 6 to 11-year-olds received 50 micrograms, and 12 and up received 100 micrograms. Moderna applied for their EUA for all ages, 6 months through 17, in that June. The EUA was granted for all ages in June. Again, the study was looking at, did they have a similar immune response to a 16 to 25-year-old control group after 2 doses? And again, this study also saw no serious adverse events related to the vaccine. Next slide, please. So this was a little bit larger trial. Over 5,000 infants, toddlers, and young children got this vaccine. So in the 2 to 5-year-olds, 3,000 got the mRNA vaccine and 1,000 got the placebo. And in 6 to 23-month-olds, about 2,000 got the vaccine and almost 600 got a placebo. So over 6,500 kids included in this trial. Next slide, please. This also looked at systemic reactions within 7 days after dose 1 and 2. So PD1 is the dose 1 and PD2 is dose 2. The blue bars are the kids who got the vaccine and the gray bars are the kids who got the placebo. You can see a little bit more fatigue noted after the vaccine, and a little bit more headache noted after the 2nd dose of the headaches and achiness, myalgias are like muscle aches, noted after the second dose of this vaccine. But again, still pretty small numbers for people who got, who had side effects after the vaccine. Next slide, please. And then this is the young toddlers. Up on top is the toddlers, 24 to 36-month-olds, and the bottom is the 6 to 23-month-olds, looking at irritability, sleepiness, loss of appetite. And again, hard to differentiate this between the placebo in the gray bar and the vaccine in the colored bars that that sometimes we just, when we're looking for those things in our kids, we sometimes notice them more, I think. But so people were asked every day for 7 days after the vaccine if they saw these things in their kids, and parents had to rate it. So next slide. So this is the one where there was a little bit of a difference, just actually pretty minor, but a small difference. And this is fevers after the Moderna vaccine. So the top row is the 2 to 5-year-olds. The bottom row is the 6 months to 23-year-olds. And again, the gray is placebo, and the blue is the kids who received the vaccine. And then they have the temperatures on the bottom. So there really were very minimal reports of kids having more than 104-degree fevers, pretty small reports of kids having 102 to 104. But there was a little bit more fevers in both the 2 to 5-year-olds and the 6 to 23-month-olds after dose 1 and after dose 2. Most specifically, there was but again, only 8% of the 2 to 5-year-olds and about 8% of the 6 to 23-month-olds had fever after their second dose. That's still a pretty small number having fever, but there was a little bit of a difference. But as you can see, it was pretty mild fever. It lasted a short amount of time, treated with Tylenol or ibuprofen. So the next slide, please. What about vaccine-associated myocarditis? Many of you probably read about this in the news in the past. There were no cases of myocarditis in young children who received vaccine in the clinical trials, 0. What we know about myocarditis is that there is an increased risk of myocarditis in 12 to 17-year-old males after the second dose of an mRNA vaccine. So really specifically in that age group, it is extremely rare. The group that's most affected is 16 to 17-year-old males, and the rate of myocarditis after the second shot is about 1 in 10,000 doses of the vaccine. So this is extraordinarily rare. It's also has been predominantly mild case of myocarditis. Myocarditis is inflammation of the muscle of the heart. But again, this is extremely rare, and this we have. The age group that we saw this rare event was in the teenage males. Next slide. In the young kids, so the risk of myocarditis after mRNA COVID-19 vaccination in young children is unknown. No cases occurred in the 7,800 kids who received an mRNA vaccine. So that's combining both the Moderna and Pfizer numbers. And then what we know just about monitoring the kids 5 to 11 is that we saw extraordinarily low numbers. I don't even, I'm not sure if it was reported at all in the 5 to 11-year group. And so that is really what we anticipate in the youngest kids. So that there's just different medical and this group at this age is actually just less risk for myocarditis in general than the teenagers. So we don't anticipate seeing myocarditis after the vaccine in this age group, similar to what we saw in the 5 to 11-year-olds. Also, the dose is lower. The dose we're using in this age group is lower than that dose that we used in 12 to 17-year-olds. Next slide, please. So when we think about and worry about the vaccine causing myocarditis, what I actually worry about as a physician is that COVID-19 can cause myocarditis as well. So, so there's a very rare chance of the vaccine causing myocarditis, but we know that COVID can also cause myocarditis. A child is much more likely to get myocarditis from COVID infection than from the vaccine. And in addition, the myocarditis that we've seen, the vaccine-associated myocarditis, is much more mild than myocarditis caused by COVID-19. So when I weigh this risk and benefit for my patients, and when I weigh it for my own children, the vaccine is more likely to prevent myocarditis than to cause it, because it is preventing serious illness from COVID, and myocarditis would be considered one of the serious events of COVID-19. So I would say that hands down, the benefits of the vaccine far outweigh the risks in this situation and across all situations for the vaccine, in my professional opinion. Next slide, please. What about late onset side effects? This is a great question. People ask about this all the time. And in vaccine science and vaccine technology and monitoring of vaccines over not just the COVID vaccines, which, like we mentioned earlier, are going to be one of the most highly monitored vaccines in US history, according to the CDC, but all the vaccines that we give, there have been no new side effects from a vaccine documented after 8 weeks after vaccination. It just really biologically and medically doesn't make sense. It could, the mRNA degrades within days, and so there's just no risk of long-term side effects from the vaccine. Next slide, please. What about the risk of COVID-19 in this age group, this 6 months to 5-year-old age group? I'm sure many of you have experienced it in your family already. I think something like 75% of Americans have had COVID-19 at this point. So next slide, Stephanie, thank you. This is hospitalizations. The yellow bar is 0 to 4-year-olds. The gray bar is 5 to 17-year-olds. This is in the United States, not in Vermont. But you can see in January, we really had a peak in hospitalizations across the United States in these age group. The vaccine came out for 5 to 11-year-olds just prior to that peak in the middle of this chart. The vaccine came out in November. Those families who got it in that first month or so were considered fully vaccinated at the time of this peak of hospitalizations. And you can see that it really dramatically decreased the rate of hospitalizations for kids 5 to 17-year-olds, excuse me. And we're seeing, the United States is seeing a little bit of an increase in hospitalizations over the last month as well in the 0 to 4-year-olds. Next slide, please. I should probably comment, actually, I was thinking it came after this. We've had very few hospitalizations here in Vermont, and Dr. Bell can correct me if I'm wrong, but we have not had a vaccinated child admitted to the hospitals, as far as I know, since the vaccine came out for 5 to 11-year-olds. So that's pretty remarkable. Our high rates of vaccination here in Vermont have really helped to protect our younger kids. So thank you to those of you who vaccinated your older children, and to all of the community who's really put forth a great effort in getting vaccines in arms for kids 5 and up. That really has helped to protect our younger kids here in Vermont, and I'm really grateful. Things that kids can be hospitalized for related to COVID, so pediatric COVID pneumonia. that can cause an infection. COVID causes an infection in the lung, and it can cause low oxygen levels, requiring a child to be hospitalized for oxygen, or even possibly a ventilator where there's a machine assisting the child in breathing. This has really been unvaccinated adolescents that we've seen this type of severe pediatric COVID pneumonia. Next slide. MIS-C is something that we heard really early on about in COVID. The initial strain of COVID that was circulating in 2020 when this started. They certainly were seeing a fair amount of this multi-system inflammatory syndrome in children in areas where they had high rates of COVID, such as New York City. We actually really aren't seeing this quite as much now with Omicron. But this is defined as laboratory evidence of inflammation. It's a very severe illness. They requires hospitalization. More than 2 body systems are involved, including the heart. So myocarditis may be present and may be severe. And unfortunately has caused deaths in children. And children should not die. So any deaths that we can prevent with a vaccine is, in my mind, that makes the vaccine worth it. Next slide, please. The MIS-C is most common in the 5 to 11 year age group, but we do see it in the toddlers and in the teenagers as well. Next slide, please. There's other reasons that kids are hospitalized for COVID. What we've seen most recently with Omicron is actually that Omicron COVID from the Omicron variant is causing croup. So croup can be caused by many different viruses, but it's when a child will get inflammation of the upper part of their airway, and they'll get this very characteristic seal cough and increased work of breathing. And some kids need to be admitted to the hospital for certain kinds of medications and oxygen related to that. We've seen kids need to be hospitalized due to asthma exacerbations, young infants not feeding well. I don't know if many of you probably lost your appetite when you had COVID, and young kids can too, and it can cause dehydration. And then it can also cause inflammation of other organs, including the brain. So these are other reasons that young children may need to be hospitalized with COVID. And again, we now have a vaccine that we can tell you will help to significantly reduce that risk of hospitalization. Next slide, please. Severe COVID cases in Vermont. So this slide again just points out that Vermont's high adolescent vaccination rate really helped to protect our youth from severe COVID disease, as cases rose during Delta and during Omicron. So our adolescents 12 and up, and then vaccinating our 5 to 11 year olds, that was just a really great effort on the Vermont Department of Health, local pediatricians, and most importantly, parents getting their children to vaccine sites to get vaccinated. Next slide, please. What if my child has already had COVID-19? Do they need to be vaccinated? And if so, when? Next slide. So in adults, there have been studies to show that there is an improved antibody response with both, they call it hybrid immunity, infection and immunizations. We are not recommending that anybody go get COVID. Please don't do that. That risk is too high. But what we're seeing is that kids who are getting both the vaccine and got COVID and then later get the vaccine, get an antibody boost. So it's almost like like I talked about earlier, that the vaccine is priming their immune system. The infection helps prime their immune system, and then the vaccination after infection re-ups that immune system. We are recommending that kids get vaccination after infection. We can talk about the timing in just a minute. But we also know that immunity from infection wanes. So I mentioned earlier that immunity from vaccines is actually more effective. It lasts longer. Immunity from infection wanes, and we don't actually feel like it offers protection, especially now that we're seeing that Omicron is mutating quickly, that immunity from a previous infection may not provide enough response to a future variant if your child were to be exposed to that. The vaccine helps to provide longer lasting immunity, and it also helps to provide protection against other, it can help to provide protection against a greater range of variants than just your immunity from infection from one variant. So, the next slide, please. So we are recommending vaccination for all children, even if they have COVID. It is okay to vaccinate as soon as your child is done with the isolation period. So day 11, they could go out and be vaccinated, but it's actually also okay to wait a bit. So your child's body just got some brief infection-induced immunity. The CDC says we can wait up to 3 months after infection before vaccination. The time between infection and vaccination, having a little bit of time between infection and vaccination may result in an improved immune response to the vaccination. The thing about that statement is that we don't have any studies. We are speculating. We also don't have a specific time frame to tell you when to go out and get the vaccine. My family and my youngest child had COVID mid-May. I vaccinated her about a week or so after it came out. So chose to do it not 90 days after, but almost as soon as it was available, about a month and a half after she had COVID. So but that timing, it's hard to give you exact information on when to vaccinate your child post-COVID, but we do recommend vaccination post-COVID. Next slide, please. Why is the vaccine dose based on age and not weight? This is such a great question because we've been seeing this throughout the entire rollout of the vaccine. What about my teeny tiny 11-year-old? Should they wait? Or my teeny tiny 12-year-old, should they wait till the 5 to 11 dose comes out? People have been asking this question all along, but we dose medications based on weight. So your Tylenol, your ibuprofen, your child's amoxicillin for their strep throat is all dosed on weight. You are totally correct. But vaccines we do differently. They're not a medication. Vaccines present information to your immune system and tell your immune system what to do. The younger children's immune systems need less prompting. You probably know that. They get everything. They bring home everything from childcare. So they do not need as high of a dose as an adult. So vaccines are based on immune system maturity, not weight. So you may know this from yourself or from family members that people with immunosuppressed conditions have been eligible for additional vaccines, and that their series may be 3 vaccines or more because of their immunodeficient state. That's because their immune system needs more of a boost. But so our young kids, they just don't need as much prompting. And so they need a smaller dose. So it's based on age. And then sometimes we do just need a cutoff. There is nothing different between a child who is 4 years and 11 months and a child who is exactly 5 years, but sometimes we just have a arbitrary cutoff and that are picked and they study kids in those age groups. Next slide, please. What about getting vaccines at the same time? It's totally okay. your child can get any of their routine vaccines at the same time that they've been getting COVID. We've been doing that for children 5 and up throughout the COVID vaccine rollout, and we are continuing to do that with our youngest children as well. It's a great time to make sure your children are caught up to date on all of their vaccines. Next slide, please. Healthychildren.org is a great resource, not just for COVID vaccine information, but for all information related to pediatric health and well-being and development. And if you have not checked this out, I would highly recommend it, but it's a great resource for vaccine information as well. Next slide, please. How is this going so far? So, in the first 2 weeks of vaccine being available, over a quarter of a billion kids under 5 have already received the vaccine. That's fantastic. And over 2,000 Vermonters under 5 have received the vaccine. Most have been given in pediatric offices. I cannot even tell you how much my office stepped up, and our staff just did an amazing job rolling out this vaccine to families. The day they got it, they opened up a clinic that night. It was parents were very excited. And then we're really seeing a 50-50 split of Moderna and Pfizer. So there's really no preference for either vaccine. Both induced an immune response. Both had a very safe and efficacious side effect panel. Both had no serious adverse events reported. There has been no preference from the American Academy of Pediatrics or the CDC as to which one your child receives. That's really your choice. Next slide. Where to get vaccinated. Our pediatric offices, your medical home. If your medical home is not offering it, the Vermont Department of Health has some walk-in clinics. That's actually where I took my child. I didn't even realize, honestly, that they were doing it, and found out a few days before, and it was so easy. Some pharmacies will vaccinate kids over 3, and then some vaccine is available at WIC if you're a WIC client. Next slide, please. This is the Vermont Department of Health's website. You can click on the blue bar at the bottom that says See Health Department Clinics, and you will see which vaccines they have available and where. And they're all walk-in. Next slide, please. Oh, this is, once you click on that, this is what it will look like. And you can see that they're offering Pfizer, Moderna. So Moderna for kids under 6 and Pfizer for kids under 5. Next slide, please. If you're unable to find your vaccine that you want, if you want your child to have Moderna and you cannot find that at one of your local walk-in clinics, or your pediatric office is not, or family practitioner does not have that vaccine, you can call, I think it's your county health. Dr. Bell's going to have to step in and tell me where you can call to get that.
Your district health office.
District health office.
Yep. Mm-hmm.
So, and these are obviously a little bit older kids. This is in the 5 to 11 year wave of kids. We need some, I should have gotten you a picture of my youngest. So I don't think I really went into great depth, and I'll do that because I assume, I haven't looked at the questions, but I assume that's one of them is, I was alluding to this a little bit at the end, the Moderna versus Pfizer. There really is not a difference between the two. I think you pick the one that you feel most comfortable with. So I've had patients select Moderna because they're going on a vacation soon and they'd like, it's only 2 shots. So Moderna is 2 shots spaced 28 days apart. And the child is considered fully vaccinated 2 weeks after that. So I'll have some patients who are going on a trip soon, or just really want to have their child fully vaccinated as soon as possible, and they choose Moderna. Pfizer is a 3-dose series. You have the first dose, the second dose is 3 weeks later, and the third dose is 2 months later. So it obviously takes a little bit longer to be fully vaccinated, but have a lot of families choosing that because that is what their 5 to 11-year-olds got. Some families will say, well, I got Moderna and I did great, or my husband got Moderna and I got Pfizer. What, which one do you have available today? Some people are, while the fever rate in the Moderna was certainly low, it was a little bit higher than in the Pfizer study. And so some people feel like, I just feel worried about fevers after vaccines and want to choose the Pfizer vaccine, knowing that the child could still have a risk of fever, but it might be a little bit lower risk than Moderna. I think there's lots of different reasons that people are picking different vaccines, and you are the best advocate for your own child. You will make the right choice. So the vaccine you choose is the right one for you and your family. I personally did Moderna for my 3-year-old, just in that vein of getting her fully vaccinated, as soon as possible. I am not really recommending that people delay vaccines till the fall. I mean, unless they just recently had COVID in the last few weeks, it's a month or so, but we don't know. Yes, we probably will see more COVID in the fall and winter as we're indoors. We always see more viruses at that time of year, but I think it's just hard to predict. And then it also takes a little while to be considered fully vaccinated. So if we delay the vaccine too much into the fall, then you're looking at a couple of months before you're considered fully vaccinated and could have exposures then. But I feel like the vaccine is here now. Unless your child very recently had COVID, this is a very good opportunity to get that vaccine, get that full protection prior to the fall. Get the protection as soon as possible. All right, Dr. Bell, what questions came in?
Yeah, so I'm gonna thank you so much. And we have a bunch of questions. Some of the questions weren't really kind of answered during your presentation, so I might skip over those. And I'll start with, this is a very practical question. So are you able to switch which vaccine kids are getting after the first shot? So for example, if you started with the Pfizer shot, but then you want your child to be fully vaccinated before mid-September, can you switch to Moderna so that you can get 2 shots by the end of August?
That is a fantastic question that I do not know the answer to.
Well, I guess I would point out that the Pfizer regimen is 3 doses. And so if any of the way the advisory group worded it is that if any of the shots are Pfizer, that you need 3. Because that's what the study showed. So the only way you can get the full regimen in only 2 doses is to have both of them be Moderna. So if that's something that you're concerned about the timing, then I would go with Moderna. And then otherwise, if you start with Pfizer, I would just finish with Pfizer. But yeah, if you did switch, you still need 3 full doses if any of those shots are Pfizer.
I suspect that there was a little bit more limited Moderna dosing in pediatric clinics that first week. And so I don't know if that's somebody who's asking because they received, I think a lot of pediatric offices only received Pfizer or received very little Moderna the first week and were offering Pfizer only. That was a limit. That was a short run. I think most offices should be able to access both vaccines at this point. But so that's good to know. So if you start with Pfizer, if you decide to switch, you still have to do 2 Moderna shots.
Right. Yeah, that makes sense. Yeah. Okay, next question. So you, Dr. Costello, you mentioned that just over 7,000 kids received the vaccine in the clinical trials, but someone asks, did the clinical trials have a large amount of children that received the vaccines? Are there concerns that we'll see some dangerous side effects from young age group when more are vaccinated, when they're vaccinated en masse?
No. Based on, yes, the studies had enough children. We use the word powered. They were highly powered, well-powered studies. There were pretty extensive monitoring of vaccines through the vaccine adverse administration reporting. But we really have not seen adverse events in those more than 10 million doses given to 5 to 11-year-olds, and even more millions and millions of doses given in the ages above. We just have no anticipation of adverse side effects that we do not know about in this younger age group. It is just very unlikely, but there will be monitoring and reporting for that. And you probably all remember the Johnson & Johnson vaccine, where it was halted immediately after, I believe it was 5 or 6 cases of a potential adverse event in middle-aged women. That 6 doses or 6 cases, that's a really low number. It can be halted really quite immediately, but like I just said, we actually really don't anticipate adverse events, unknown adverse events, because we have not seen that at all in millions and millions of doses given to kids 5 and up.
Yeah, and I think I would just add that we've done these types of webinars for each age rollout, and so this was a question for the 12 to 15-year-olds, right? Like the clinical trial included however many couple thousand kids, and people were like, that doesn't seem like enough. But at this point now, we've had 17 million children vaccinated, and same with 5 to 11. It was, a couple thousand, 5,000, I think, children in that clinical trial. Some people said that didn't seem like enough, but now we've had 10 million. So I think, the clinical trial is going to be smaller than when we have more children vaccinated, but the benefit for this age group is that the adolescents have already gotten it, the 5 to 11s have already gotten it. So we have a ton of experience so far.
I also think it's, as much as I am recommending this for my patients and brought my own child to be vaccinated right away, it is okay to watch and wait for a month or two. That is okay. I think, we do have a vaccine available now. We can offer protection now, but if the right choice for your family is to wait a little bit and continue to watch as we roll this out, as kids get the second dose in just a couple short weeks here, but that's okay too. Do what feels right to your family. But for those of you that are ready to vaccinate, we have a safe and effective vaccine available for you now.
All right, next question. How long after the vaccine would you expect myocarditis related to the vaccine? What's the time frame?
It's in the first couple of weeks after the vaccine. And I think even actually most situations in the first 7 days after the second dose.
Yep.
For the Pfizer, for the kids who received Pfizer in that 12 to 17-year-old range.
This is another example, I think, of for me was really reassuring, which was, again, something that was picked up, not the clinical trials didn't pick it up. But then once it was, to a previous question, once it was given to a huge, sometimes you need to give it 1 million times before you see an extremely rare side effect, right? And we want to know about those. And so this was picked up after, millions of people had, adolescents had received the vaccine. And so they actually did a pretty, they looked at what is the baseline rate of myocarditis, because we have kids with myocarditis in this age group for lots of reasons. It's rare, but we see it. And so then they were picking up a signal where within the first 7 days after the second dose in adolescent males, it was a little higher than expected if you take the random baseline cases. And so then they said, I think we're going to attribute this to the vaccine. So it is in the first 7 days after the second dose for adolescent males.
And it's been very mild.
It's more mild.
With ibuprofen.
Yeah.
That much more mild than the myocarditis that our colleagues are seeing across the country from the COVID infection.
Yeah. How many other countries are vaccinating kids under 5 yet? Is the US the only country right now? And I actually just had to look this up recently.
I know, I was going to say, I actually don't know.
I can actually tell you. So From my read, there are maybe two vaccines that are given to kids under 5. Elsewhere, one is a vaccine developed in China and one is a vaccine developed in Cuba. And so I think China and a few other countries, maybe in the Middle East and Asia, are using the vaccine from China, and they're vaccinating those above 2 or 3. And then the vaccine developed in Cuba is being used by a few South American countries, in addition to Cuba, to vaccinate those 2 and 3 and above. And that's, I think, been ongoing for a few months. Okay, next question. This is a good one because this is a common one. What about a next vaccine that responds to Omicron and newer variants? Do we anticipate an updated vaccine for kids when this is released?
I think this is also, do we anticipate boosters? Yes, we've had boosters for adults. We've had boosters for the 12 and up. For 5 to 11-year-olds, we do anticipate that there will be boosters. And from what I understand, is that the vaccine companies are starting to look at more Omicron specific variants, or having 2 variants, protecting against 2 variants within a vaccine. So the flu vaccine is a quadrivalent vaccine. We protect against 4 strains of the flu in that flu vaccine. The COVID vaccine right now only protects against one. Only induces your body to make one particular spike protein. I think they are now looking at bivalent, so protecting against 2 strains. I don't have any information on when that's anticipated. I think there was some hope for the fall.
Yeah.
And when it would be available for kids 6 months to 5 years, I don't actually have that information either. But I anticipate that we're just going to continue to hear about boosters, and that this will be refined. And my hope is that over the years, we'll get to something similar to the flu vaccine, where maybe we can just do it once a year. We have had some sad children in our office.
Yeah. My youngest said his least favorite part was the pokey part. So yeah. It's not where, it's still a struggle. So Moderna is actually, they're studying a 3rd dose for this age group right now, and some of their clinical trial participants are receiving their bivalent vaccine, which includes Omicron, which is interesting. So they might have data even in the young kids by the fall. Certainly, there's some emerging data already for adults for an Omicron bivalent vaccine, and it potentially may be available for adults in the fall too. So we anticipate that there's going to be more vaccinations. We do know that Omicron infection on its own it's not been a great immune inducer. Like, it doesn't create great immune response to anything really besides Omicron. And even then, if you've had a mild case, it's not very durable. So really thinking about, like, we don't know what the next variants are going to be. And the vaccine, even though it's based off of like a previous strain, it really does seem to help create some durable response in some of the like memory cells and stuff in our immune system. Okay, this is so it sounds like with the new variants, the vaccine no longer provides sterilizing immunity. Do you have any stats on how the current vaccines prevent severe sickness in children under 1?
So when the vaccines initially came out, we saw that they both protected against severe disease and death. And then, oops, surprise, they also protected against actually getting COVID. And that was pretty remarkable. And I think we all really latched onto that, and we're very excited about, wow, this prevents us from actually getting COVID. As new variants have emerged, clearly the vaccines don't protect as well against getting COVID, but they continue to protect really well against hospitalization, serious illness, and death. And that's really what we develop vaccines for. I mean, all your pediatric routine vaccines are to prevent serious disease. We have to speculate a little bit here in this specific question. So we're looking at, do these kids in this age range produce a similar antibody response, or the same or higher antibody response than this group, this large group of 16 to 25-year-old patients who are in the trials? And yes, these vaccines induced the same antibody response. This was also the same way they studied 5 to 11-year-olds. They weren't looking for efficacy of the vaccine. They were looking for, does it produce an immune response? And they got that immune response. And we can see with the 5 to 11-year-olds that it did protect against severe disease and hospitalization and death. So we are speculating. We don't have a lot of data, because actually there weren't a lot of cases in specifically the Pfizer trial. There weren't actually a lot of cases of COVID. So we will, not me myself, but obviously the vaccine manufacturers will continue to monitor this really closely. And that, if there are changes, there may be additional doses needed, but there is no reason to anticipate that they would not have the same protection that 5 to 11-year-olds and older adults have with this similar antibody response.
Okay, next question. Have any statistics been published about the 250,000 kids under 5 having any adverse side effects besides normal COVID symptoms? So I think this question is asking about that you mentioned 250,000 children have received the vaccine under 5 in the last 2 weeks. What do we know about that? And sort of how do we keep track of that?
We are alerted by the health department anytime we get a lot of health department alerts. But we are alerted by the health department, who would be alerted by the CDC if there were to be any concerns. And I have not yet received or heard any reports of adverse side effects. But I'm actually also wondering, is this asking about adverse events to just a COVID infection? And we have had young kids be hospitalized for COVID here in Vermont and across the United States. We've had kids who've had more prolonged disease. Meaning like not long COVID, but just been sick for many days, meaning missing work for parents, missing childcare for the child, just having a sick kid, which stinks. And I would say, both as a pediatrician and as a mom, this is a low risk vaccine. We might be protecting against a pretty low risk virus. Like most of the kids who get infected with COVID have a more mild course of COVID. But if your child did have a complication from COVID, that can be very serious. And this is a low risk vaccine with really very low risk of adverse events from the vaccine. And in my opinion, if you're looking at risks, like which risk would you want to take? I would take the vaccine risk over the COVID risk any day. Yes, both low risk situations, but I would pick the vaccine. So.
And I would add to that question in terms of statistics. There are various forms of surveillance, vaccine surveillance programs that are federal programs. So there's active surveillance, and you might recall that if you got vaccinated yourself, you can sign up for the V-Safe program, and like you would get texts saying, how do you feel today? And there are other types of active surveillance programs where you would submit symptoms. There's the vaccine adverse events reporting system, which anyone can just make a report. So those are active surveillance programs. There's also passive surveillance programs where they actually look for billing codes and certain diagnoses that could be associated with the vaccine in certain populations. So for instance, now that we know that myocarditis in the adolescent male population could happen, there's surveillance that's happening to kind of try to pick that up as well. So there are programs that really try to look in. I think Dr. Costello's example of the J&J vaccine is a good one, because again, it's to me a reassuring sign that, despite people being very excited to get the J&J vaccine, it was halted initially so we could get more information because of those reports of those adverse events. Here's another question. So this is a follow-up on, if you switched from Pfizer to Moderna. So if a child had the first Pfizer shot and then switched to Moderna, are there any health risks involved in doing so?
I was just looking at this question too, and we don't know. I think probably very low health risk, but that wasn't studied. So that's the piece around this. And I would say in that particular situation, if you are wanting to switch, I would chat with your medical provider. I worry a little bit about you going into a walk-in clinic and saying, I want to switch. I'm not sure if they would, I think they'd probably be a little bit hesitant about that, just because that's not how the vaccine is supposed to be administered. And the Pfizer study was great. It really did show great efficacy. So the immune response that we were looking for, it did take 3 doses of the vaccine, but I think I have no hesitancy giving my patients Pfizer. I picked Moderna for my own child. 2 shots seemed better to me, and in a little bit shorter time, knowing that she will need a 3rd one most likely in the fall, and she will get boosters, but just for right now, that and honestly, actually, that was what was available at the walk-in clinic that day. But I have no hesitancy recommending Pfizer for anybody. So I think, but this might be a situation where you'd need to chat more specifically with your healthcare provider to be able to get that one. So.
And then if you started with Pfizer, you still need those 3 doses. So, at that
getting point, 3 shots, yeah.
You still need to get 2 more, yeah. Okay, next question. This is about mRNA vaccine, like mRNA technology in general. Why is this vaccine mRNA versus a more conventional type of vaccine? Though it's been studied a long time, it still feels new. What are the risks of mRNA that don't exist with conventional?
I think it's been really more just irritation at the site because of the lipids that it has to be suspended in. And then this has not been nearly as much of an issue as we thought earlier, but storage of the vaccine. So a little bit more like logistical stuff around the mRNA vaccine, but actually really in terms of risk to you or specifically your child. Having now given millions and millions and millions of doses to this vaccine in 5 and up, there's really no different risk. And I actually haven't had as many younger kids, even in the 5 to 11 year group, complain much of irritation at the site of the vaccine. That might, I think maybe was happening more with the adult dosing. Just from the fat that it has to be suspended in to give the vaccine. So, but.
And I think for, there are other non-mRNA type vaccines that are being like, the J&J vaccine, and in some other countries, AstraZeneca has a vaccine that's similar. It's an adenovirus vectored vaccine. There's Novavax, which is also kind of a more conventional type vaccine that people are used to. But honestly, I think because the mRNA vaccines, again, like hundreds of millions of people in the US have gotten it, have done well with it, that I don't even know what, and some of my ID colleagues would know better, what the future may hold for even other types of vaccines like the Novavax vaccine potentially even being authorized here, because we have so many good options with the mRNA vaccines. So it does feel new, but it's one of those times. I mean, can you think of another time really where we've just vaccinated the entire, so a huge portion of the entire population. And we have so much data now spanning about 2 years on people who've received this vaccine. So I think I'm going to end with this question, Dr. Costello. Maybe you could just kind of generally, it's a great question that sort of captures, like, I feel like the essence of what parents are asking these days. And that is, someone writes, our kids have all had COVID already, and they did better than we did as adults, and the adults were vaccinated. So I just worry about exposing them to another unknown risk since they already had COVID and they really did fine with it.
You're totally right. This is, everybody's asking this every day in the office because we have seen a lot of pediatric COVID this year. I don't know, and none of us know what the future is going to hold for these different variants. I don't know what the next variant could be. Could there be more MISC with the next variant? Could there be more pediatric health consequences, more pediatric health hospital admissions? We just don't know. COVID has really been this unknown, and things are changing rapidly. And man, I wish that immunity from infection would last much longer, but it doesn't. Actually, to be totally honest, I had it about 6-8 weeks ago, and my husband did not at that time and just got it a week or so ago. And I asked our ID specialists, like, does my immunity from my infection a month and a half ago, does that help protect me right now? And they said, we don't even know, possibly not. So COVID is just changing, the variants are changing. And I think in my, my decision as a parent and my decision as a pediatrician is that this is a really low risk vaccine, and it protects against this unknown. If we had a crystal ball, we could give you a better answer, but we don't. And this, in my opinion, this vaccine carries very low risk, and COVID carries higher risk. And if we're making risk benefit analysis all day, whether we want to or not, we don't think about a lot of them, honestly. But am I going to put this sunscreen on or this sunscreen? We don't really look at it. But this, in this situation where we're thinking about the risks, I think we take risks all day. We take risks in every aspect of our life, and this seems like a very low risk decision to me.
I will just add, working in the pediatric ICU, I mean, we all know that adults, and especially what's the biggest risk factor for having severe illness is age. And so we know, like, the oldest in our population get the sickest from COVID. I've even seen that sort of stratified across the pediatric population, like the adolescents have gotten the sickest, who have been unvaccinated, of the kids that I've taken care of. And so this is a thing that this virus isn't going to go away, and our kids are going to be exposed to it over and over again. And I had the same experience as the person who asked the question. My youngest was too young to be vaccinated when he got COVID and did really pretty well, but I know that he's going to be exposed over and over again in his lifetime, and that as he gets older, likely that risk of him having severe illness is just going to be greater. And so this is an opportunity for me to provide my child with an opportunity to get information about the virus, to start to build some immunity against it, and moving forward to be more prepared when he comes in contact with it again. So that's sort of how I think about that as well, is that it's just a safe and controlled way to give information about this virus that probably they will see. I mean, our kids are going to see it more than we're going to see it, right? Like, they're going to see it over and over again, probably for their lifetime. And this is an opportunity for them to start getting information about that when they're young, and they can start preparing their immune system for it. So I want to thank everyone for joining us. This is going to be recorded and put on our website. So we want you all, if you want to share this recording, please feel free to do so. And we really thank you all for your really excellent questions. And again, want to say that your child's medical provider will be able to talk to you more about your individual situation as well. So thank you so much. Thank you, Sarah, for your time. Thank you, Dr. Costello, for your time as well and your expertise in this. And we'll have another session in a couple of weeks. And so if you have more questions, we'd be happy to have you join us again. So thanks again.
Thank you.